Unit number 4. First aid. We all need help at times in our lives. Sometimes we may have accidents and we may get hurt. When we are injured or suddenly become unwell, we need someone to help us. Someone who knows what to do. It is a temporary and intermediate help. This timely assistance, comprising simple medical techniques, is most critical to the victims and is often life-saving. Any layperson can be trained to administer first aid. The first aid can be carried out using minimal equipment. First aid knowledge ranges from taking care of cuts to dealing with an unconscious victim. Cuts and scrapes. Handling minor accidents at home or on the road develops a sense of crisis management. This may prepare people to tackle with unexpected emergencies with great confidence. Minor cuts and scrapes usually do not need to go to emergency room. Yet, proper care is essential to avoid infection and other complications. Following guidelines can help you to handle crisis and take care of all. Stop the bleeding. Minor cuts and scrapes usually stop bleeding on their own. If they don't, apply gentle pressure with a clean cloth or bandage. Hold the pressure continuously for 20 to 30 seconds and if possible, elevate the wound. Don't keep checking to see if the blood has stopped because this may damage or dislodge the clot that is forming and cause bleeding to resume. If blood spurts or continues flowing after continuous pressure, seek medical assistance. Clean the wound. Rinse out the wound with clean water. To clean the area around the wound, use soap and a washcloth. But soap can irritate the wound, so try to keep it out of the actual wound. If dirt or debris remains in the wound after washing, use tweezers cleaned with alcohol to remove the particles. If debris still remains, see your doctor. Thorough cleaning reduces the risk of infection and tetanus. Apply an antibiotic. After you clean the wound, apply a thin layer of an antibiotic cream or ointment to help keep the surface moist. The products don't make the wound heal faster, but they can help your body's natural healing process work fast. Certain ingredients in some ointments can cause a mild rash in some people. If a rash appears, stop using the ointment. Cover the wound. Bandages can help keep the wound clean and keep harmful bacteria out. After the wound has healed enough to make infection unlikely, exposure to the air will speed wound healing. Change the dressing. Change the dressing at least daily or whenever it becomes wet or dirty. If you are allergic to the adhesive used in most bandages, switch to adhesive-free dressing or sterilized gauze. Held in place with paper tape, gauze roll, or a loosely applied elastic bandage. These supplies generally are available at pharmacies. Watch for signs of infection. See a doctor if the wound is not healing or you notice any redness, increasing pain, drainage, warmth, or swelling. First aid kit. Every office, factory, home, and school should have an accessible first aid box with the following recommended basic contents. First aid book clearly explains how to handle basic problems. Band-aids, plaster. Band-aids or sticking plasters are good for dressing small wounds. They come in all shapes and sizes for fingers, legs, and anywhere else. You might get little cuts. Make sure the band-aid is big enough to cover the wound. If not, you should use a dressing instead. Elastic bandages. The elastic bandages are good for wrapping sprained joints or making a sling in case of a broken arm. Gauze and adhesive tape. Gauze pads or rolls are cloth pads that are placed directly on the wound to protect and control bleeding. For larger cuts and scrapes, you will need adhesive tape to keep gauze in place. In an emergency, a clean cloth, hand towel, clean t-shirt can be used to cover the wound. Antiseptic wipes, alcohol swabs, and cotton wool. Safety pins and tweezers. Scissors. A pair of scissors is needed to cut the tape and gauze. Latex gloves. Latex gloves are always a good idea, especially if you are dealing with body fluids from a stranger. Calamine lotion. Calamine lotion is used for soothing sunburns and stings. Clinical thermometer. Analgesic tablets, such as aspirin or paracetamol.